Millions of people in the United States lack access to quality health care and suffer disproportionately high rates of infection, medical complications, and even death from serious diseases. These health disparities affect women of color at alarmingly high rates. According to Department of Health and Human Services data, Hispanic women are 40% more likely to be diagnosed with cervical cancer and 30% more likely to die from the disease as compared to non-Hispanic white women. And breast cancer mortality is approximately 40% higher among Black women compared with white women. But a program in Florida is trying to change these statistics by removing financial, cultural, and educational barriers so more women gain access to life-saving preventative care, including getting screened for breast and cervical cancers. Their innovative model could be replicated all across the country.
I came here over 20 years ago. Actually, Found Care was the first place that I started working. I worked for 21 years as a HIV case manager, and then 2 years ago, the position as Promise Fund navigator became available, and it was offered to me.
I created and co-founded the Promise Fund in 2018 when we realized that many, many women had been diagnosed with breast and cervical cancer who had no primary care, no medical home. We wanted to make it possible for them to at least be screened, and then we would figure out how to get them navigated to places, physicians, caregivers that would guide them into places who would dedicate or volunteer their care and efforts to make sure that these women were treated. We created a new systemic way of putting the pieces together that we knew would ensure a lower resource woman a path to wellness. Most people in this situation don't know how they're going to get through the day, let alone the next day where they're going to get their screening. How do they take care of their family, let alone take care of themselves? And they usually put themselves last. So the job of the navigator is to be a consistent figure in their lives.
I educate the patient about breast and cervical cancer, the importance of taking care as a woman to be mindful that breast cancer do not produce any symptoms.
Many of the patients never go to the doctor or the place because he say no speaking. It's in the English. Sometimes he say no, I can't because it's in English. She understand me because he speaks Spanish. But sometimes he say, you speak beautiful Spanish, where you from? He say, I'm from Cuba, it's my language. It's feel happy, feel confidence when you speak the same language.
I made sure that not only I enroll the patient in the program, I made sure I schedule the patient's appointment. I want to be certain that the patients know where to go, and if it happens that the patient doesn't have any means of transportation, I'm there to coordinate transportation for the patient. I make sure I get the reports. I call the patient to find out if everything is fine. So as a patient navigator, it's my role to link them to the right resource so they can get the help they need.
Moi, j'ai rencontré Ketli, c'est pendant que moi t'ai venu faire un examen.
She was scheduled to meet with the health provider for a colposcopy and also to have a mammogram. She was referred to me so I can find the proper channel to assist her financially. And she said that meeting me was the greatest thing for her because I didn't meet her as a simple employee. I used everything that I know to give her the assistance that she needed.
The last midterm, I was able to assist 130 women, and among them, there were 12 who were diagnosed with cancer. And I was able to link them to the right resource to get continuation of medical treatment. I take pride in that. Yes.
¿Qué tan importante soy yo para ti?
Mi confidente, mi persona en quien yo me apoyo.
La première fois que je t'ai rencontré, c'est comme si tu avais un impact qui t'est fait entre nous deux. Et puis,
She said that from the first time she met me, she felt like that. She was at the right time, at the right spot. I gave her what she needed, and I really impacted her life. Thank you.
Restez de même.
Thank you, appreciate that. Thank you.
We have either screened, interacted, treated, educated almost 20,000 women with our partners in a year. Our goal is to double that amount of women next year and then double it the year after, so that we get through this population and they get used to screening and they understand the value of prevention.
None of this would be possible without the financial support and the technology made available by our friends at Hologic. For more information on these partnerships, visit hologic.com/Project Health Equality.